Now we have the congenital anomalies of central nervous system. I'm Assistant Professor Dr. Inas Fadel Kalam from University of Baghdad College of Dentistry. First of all, it is related to the neural tube defect. Neural tube defect of the embryo arises approximately at 18 days after fertilization. During the fourth week of development, the neural plate invaginated along the embryo midline to form the neural groove. And the neural tube is formed as the closure of the neural groove proceeding from the middle of the groove and progress toward the end in both directions, with completion by 24-day for the cranial end and the day 26 for the caudal end. And the result is a neurula, and this is the process of neurulation. Okay, now we have the neural tube in normal cases. If there is a disruption of the neural closure progress give to the neural tube defects. One of these conditions called anencephaly results from failure of the neural tube closure at the cranial end of the developing embryo. Absence of the brain and calvaria may be partially or complete appearance in this condition. So there is no brain, no calvaria in this condition. We can classify the neural tube according to where the defect occur. If it is occur in the anterior part of the neural tube, lead to the anencephaly in and also encephalocele. If it is occur in the posterior part, so lead to the spina bifida. This is the picture as we show anencephaly. Anencephaly, there is no brain, absent of the brain and absent of calvaria, while this is the normal case. There is a brain, there is a calvaria. So this there will be a difference between the two images. Anencephaly, also there will be the brain and the cranial vault also more formed, and the major portion if the brain is either reduced or absent, but hindbrain present. Okay, so, and the facial structure generally present and appear normal. The facial appear normal, where there will be absent or reduce of the brain, but the hindbrain is present, and there will be a brain and the cranial fold also more formed, and it is a cause of the neural tube defect. The cranial lesion, occasionally covered by the skin, may or may be not covered, and the defect of the neural tube fails to close during the third to fourth week of development. If it is occurred during the third to fourth week, lead to the fetal loss and stillbirth or neonatal death. Also, generally, anencephaly occurs due to multifactorial, even it is a neural tube defect, but also it may be there will be interaction of multiple genes as well as environmental factors. Also, in anencephaly, we can detect it. It can be detected prenatally through the ultrasound images, and the folic acid has been shown to be an efficacious preventive agent that reduces the potential risk of anencephaly and other neural tube defects. Folic acid is a drug like vitamins. The pregnant women must take to prevent the neural tube defect. Okay, and she can take it before pregnancy and in the third month of pregnancy to prevent the neural tube defect. This is the picture of anencephaly. As we see, there will be a reducing in the brain and calvaria and absent of the vault of the skull. The other condition is called acrania. Acrania, this is rare disorder in the human fetus in which the flat bones in the cranial vault are either completely or partially absent, while the cerebral hemispheres develop normally and complete development we show in this case of the neural tube defect. As we see in this picture, a crania, the flat bones of the cranial vault is completely absent, and in the crania they are either completely or partially absent, while the hemisphere is normally formed. The other condition called encephalocele, neural tube defect characterized by sac-like protrusion of the brain and membranes that cover it through opening in the skull. These defects caused by failure of the neural tube to close completely during the fetal development. This is the picture of encephalocele. As we see, this is the sac, okay, of the brain and its membrane, and there will be a penetration of the skull from this part. This is encephalocele, and this is a big one of an encephalocele. Now we have the posterior part defect of the neural tube, which is called the spina bifida. Spina bifida occur when the spine and the spinal cord don't form properly. The neural tube is the structure in developing embryo that eventually becomes baby's brain, spinal cord, and tissue enclose them. As I said before, the neural tube, the cranial part of it, will become the brain, and the straight axis of the tube will become the spinal cord, and it is enclosed with its meninges. Okay, so if there will be an defect during the closure, it will lead to the spina bifida. As we see, this is the picture of it. Also, it is sac. It may be either well in the in the defect in the skin of the baby in the dorsal part, and it may be anywhere, maybe in the middle area of the spinal cord, or maybe in the posterior part, but most commonly it is in the posterior part of the spinal cord. So there is a sac of meninges of the spinal cord and its nerves ending, and the treatment related to the severity of the case maybe we can reduce the sac to its position by surgery and suturing of the skin above it. But in many cases, it leads to the paralysis of the baby, of its legs. In the lower part of the baby, there will be maybe a paralysis, or maybe it is mild and lead to the lumping only, or maybe he will have a life as a normal babies. So it is depend to the according, and it depends on the severity of the case. The treatment depends on the severity of the case. Also, this is a fetoscope repair of the spinal cord. This is the spinal cord of the spina bifida. This is the spina bifida, as we see in the back of the baby, has the meninges and the nerve ending of the spinal cord.